Hi, everybody. My name is Roshni Mishra, and I'm a part of a social media group called PCEP Self-Criticism. Today, we are joined by Dr. Rao. Please introduce yourself.
Hi, I'm Dwarki Rao. I'm a psychiatrist and a psychoanalyst practicing in Ann Arbor. I teach residents at the St. Mary's Hospital in Livonia as well.
What is the most common mental health issue you see in students? Why is this, and what is this issue influenced by?
If you look at government statistics, it's going to be anxiety and depression. Those are the commonest ways people feel distress. But I'd like to go beyond it a little bit as a psychoanalyst and say there are reasons for the anxiety, reasons for the depression, and sometimes looking at just the terms is not as helpful as knowing what's causing the depression. And that's the myriad different reasons for why people get depressed or anxious. Also important to know is that, you know, it is said that the stats say that by the time you're 18, 75% of people will have already shown mental health symptoms. So by the time we get to 20s and 30s, if you looked, you would have found it before 18, which is a remarkable statistic. What was the rest of your question?
The rest of my question was kind of why is this, and what is this issue influenced by? What are the things that may cause this issue?
It's like asking what makes the interest rate go up or go down. 8,000 reasons. But broadly speaking, it has to do with how one is brought up, what a family is like. Is it warm, comfortable, loving, giving, able to see the person as a separate person, put pressure but not too much, you know, ask a lot but not ask too much. That's the kind of backdrop that helps someone be stable, comfortable, and be aspirational. So that's one thing. Then comes school, the rest of life, making friends, having friends, staying with friends, being able to, push oneself, but not too much. Because you're doing this not for love, you're doing it for yourself. If you can do that, which is obviously very hard to do. So, because every step is a challenge, you can either be successful at it or you can slip up a bit because every step of this is not easy. You need all the help you can get. That's a quick way to put it. Now, there are, genetic influences. There are, family traumatic experiences, things that are not really in your control. Societal issues, money issues, the issue of whether you're feeling othered or included or accepted. Everything makes a difference.
To kind of piggyback off of that question, would you say self-esteem and confidence issues are common in teens? And if they are, why do you think so?
They're very common. However, the myth is it's only in the young people that it's common. It's common throughout the life cycle. The older people have self-esteem issues. The young little kids also have self-esteem issues. So the way to think about it is teenage years, as we all know, is both an adventure and a bit of a horror show because you're learning about how to leave behind your childhood, which has been a safe haven, and venture into adulthood, broadly speaking. How tough is that? Very tough. How exciting is it? Very exciting. But the making that passage to adulthood is filled with trial and error kinds of things. You try out 100 things. You try out new identities, new ways of thinking, thinking outside the box, meaning outside of your family box. So it causes a lot of stress because at any given moment, you're not sure if you're doing the right thing, you're doing the things that you'd like to be doing, or is it something else, something that your parents want you to do? This dilemma goes on for, as you know, years. And I would say, rather than call it pathological, best to call it developmental. It's this necessary step. Most of the time, it works out okay. Sometimes it doesn't, as we know too. So I'd like to look at this, teenage years as not just angst and confusion and worry, but a very important forward thinking step, which takes time, which takes effort. It takes some ability to make mistakes and come back from it. So if I would use one word to describe that whole phase, it is building resilience and using resilience. If you can do that, it's a breeze. If you can't, it gets tougher.
And I feel like a lot of people use the term self esteem and self confidence, and sometimes they don't have a very solid understanding of what that is. What would you say is high and low self esteem?
Well, I would say there's normal self esteem, there's no self esteem at all, which is a problem, and there's too much esteem, which is also a problem. That's how I'd like to divide up. Okay? So you can have appropriate regard for yourself as a person that's a good person, a lovable person, a likable person, a respectable person, maybe most of all, an acceptable person. If you can have that, you have good self esteem. That comes from, again, I'm a psychoanalyst. I look at the past to explain the present, maybe more so than most other people. So I have a bias, I'll freely admit. So in that bias, the self-esteem is built at the earliest months of post-birth. So when you're 6 months old, 1 year old, you need a mother or a parent or both, really both parents who can look at you and see you as a separate human being that's not just an extension of themselves, and see you, hear you as a different person, but as a respectable, separate person. That's usually automatic. You don't have to teach people how to do this, but sometimes it doesn't work like that. So there's a self-esteem can take a beating as early as 6 months, if you can believe it. Let's say you come through all that pretty well. Then you come to teenage years where you're now reliving another saga of deciding who to be. What's your new voice? What's your new identity? So that causes new pressures on what you maintained as your self-esteem. There'll be bumps along the way to self-esteem. So, but again, as I said before, these bumps are normal. The question is, can you come out of it quickly enough? Now, there are two ways self-esteem presents itself, which may well be, another part of your question. For some people, it presents as being depressed, being saddened, being, reclusive, getting out of the social network, not being involved, not feeling deserving, and can lead to serious depression sometimes, even thoughts of not wishing to live. It can go all to that end, to that end. The other way, paradoxically, is people who have low self-esteem pretend that they have nothing but high self-esteem. They're aloof, they're grand, they're supercilious, they feel superior, and they act like nothing bothers them. But it's the front, is to avoid being crushed by low self-esteem. And that takes some doing to figure that out. Because sometimes you can pretend well. Most people can pretend very well up to a point. So those are two extremes in which you can find low self-esteem showing itself in those different ways. It's a serious situation to be taken seriously by everybody around. I think friends, neighbors, teachers can be extremely helpful. I myself, know teachers who are like born psychiatrists and psychoanalysts. They seem to know everything. They're very astute. They're very loving. When they look at you, when they look at young people and say something's up, usually something's up. So I say, let's pay our teachers more than we do. Among other things.
Yeah, and I agree totally. Getting back to that low self esteem topic that you definitely touched on, what are some risk factors that can lead to low self esteem? In other words, what sometimes are the environments or the circumstances that you see in people that will ultimately lead to them having low self esteem?
So if you believe, as I said before, if you believe in the idea that these things start early, You're building up like a bank account of self-esteem. If it's a healthy bank account, you can take, certain hits and do fine. So this would mean, well, an example, a person says, I'm going to be good in my English. I'm going to be good with my math, good with my science or my sports. That's all good, right? That's what people like to do. But if your self-esteem is somewhat fragile to begin with, these good things start to take on huge meanings that they really don't have. So rather than think about yourself, do you have good self-esteem or not? You start to identify with you as a sports person or as a math person or some other fashion person, whatever other person. What should be things of joy, start to become burdens. That's the biggest kinds of things where self-esteem shows itself as being fragile, not solid enough. Now you have to appreciate that, you know, what we learn at school is not just how things go wrong, but how things go right. So I want to focus on how things go right. There's a chance to get out of these things at every stage. It depends on what's around you. I would list high up there friends and relationships that you can trust somewhat. Because openness to someone, being vulnerable to someone, immediately helps you to feel like you can have bad days. You can have days that you can't figure out what's going on and come back out of this low self esteem, sinking feeling. So, uh, so this early phase where things are set in a solid way by parents and family and society and money and so forth, very important. After that, I want to add one other way, that self-esteem starts to feel under pressure. This is when a young person says, here's what I want to do with my life. Here are my aspirational goals. Now, the higher the aspirations, the more complex they are, the more you have to feel like I'm steady within myself. If you're not, you feel like you're going to be pushed here and there by the forces that you didn't make for yourself. You just want to be good at something. But you find that it comes with self-esteem issues, it comes with self-respect, it comes with failures, it comes with, tackling the unknown, many, many things. My advice to people is to meet that problem head on. Don't wait for it to come to get you. You go get it. Take up something you want to do. Take up a challenge. See what happens to your self-esteem. Why let the problem come to you? You know, I can expand on it, but you see what I'm saying. There are ways to get around it for all of us. And last thing I'd say, there are people who are at particular risk if there's problems at home, drug use or alcoholism at home, there's illness at home. Uh, Parents and important people haven't been able to be around, even if they wanted to be. These are the people who need to be fully aware that they're at some greater risk for feeling fragile about themselves and be open about it.
And like I know you kind of touched on this already, but a big part of our campaign are protective factors. We want to actively give people certain suggestions of what they can do to implement practices or implement social networks that can help them improve their self-esteem. So my next question, which I know you kind of already talked about, what can some adolescents do to prevent themselves from having low self-esteem? And this can be in like the grand scheme of things, or it can be very like small daily habits like journaling.
Well, I think that's a wonderful question. And the answer is going to be lengthy, but I'm going to focus in on something that I've found in my practice when I try to help people. And I work with a lot of young people, including young doctors who are learning how to be a psychiatrist, for example. So my sense is you need a purpose. A purpose will carry you through many of these ups and downs. Now, your next good question is going to be, well, how does one get a purpose? Because that's not so easy when you think about it. That takes trying things out, just as I was saying before. The question is not, do you have a purpose? The question is, will you work on it? patiently, thoughtfully, without putting too much pressure on yourself. That'd be one thing to do. A second thing to do is you have to find and make and keep a friend. It isn't enough to, you know, be socially adept. That's good too, but you need a deeper friendship with one or two people in your life. That can help you tremendously. It even helps you live longer, as it turns out. So you can not only do well as a teenager, but you can do well as an adult and well into adult life and even old age. So the importance of being with people is going to be huge. No, there are no classes. Nobody has classes on how to make friends. Nobody takes courses on how to make friends. So how do you do it? Just be human. Let yourself be human. Human beings have an inbuilt, hardwired way and method of meeting, being with, and succeeding being with people. But you do have to give it enough room. You have to give it play. It won't happen by itself. So what does that mean? It means you have to try to be with people because that's your most protective factor against low self-esteem. Nothing helps you like a group of people. Even your club, even your organization that's making all this happen. Even that, in that you're finding identity, you're finding purpose, you're finding ways to connect with people and have people connect with you. So you're an example of what I think most people should do in their way, whatever way that is. I mean, I can tell you, I know of someone who went from a very dark place and just by trying to learn a new instrument that she hated and was frightened about playing, she tried it, had a very good teacher, went to classes, and it became the most important hobby in her life to this day. Now, life has gone on. This is 12 years later. She loves the fact that she has this hobby. So never knock hobbies. Hobbies are very, very important, I think. I Lastly, I would say try something that's a little outside of your comfort level, outside of the box of comfort we all build around us. Step a little outside of it. It could be anything. It could be travel. I've heard people tell me learning a new language is like being a baby again. When it is being a baby again, but it can be extremely helpful. So I'll stop there, but maybe you can ask me more about it if you like.
Yeah, for sure. I think to kind of touch on something you said before, a lot of teen years are characterized outwardly, by people, by family members, by just society as years of angst, as years of like rebellion. But in reality, there are a lot of complex emotions that happen during your teenage years, a lot of building to who you are. What's one piece of advice you have for adolescents in regards to mental health in general?
Well, let's take up where you began, this sense of being rebellious. It's rebellious on the surface, but it's actually trying to become someone is what it really is. Most people can't become someone without rebelling somewhat. So if someone says, I've never rebelled, I'd start to worry a little bit because they haven't found maybe a way of being outside of the family, situation or the boundaries of the family or the parent or society even sometimes. So one piece of advice I'd give is the things we call rebellion, things that we call, difficult stuff actually isn't. They're necessary things. Now, that's hard to do when you're rebelling. In the middle of a rebellion, you can't say, hey, this is a good thing. Mostly you're saying it's a bad thing, and you feel like other people are going to say it's a bad thing. But know this, it is not a bad thing. It's probably the best thing. But you have to be patient with it so that you can find a way to begin your own adventure, your own identity. While, remember, it's a rebellious phase. It doesn't mean you're going to be divorcing your mother and father. It might feel like it though, but that's not what it means. So my piece of advice would be all the things you've heard about as being difficult and bad and something you probably should try not to have. I would say have those feelings. Even I mean work with them. Enjoy them even a little bit because they're going to help you deal with life, adulthood, these changes, and frankly, helps you deal with your parents too in the end. Believe me, these parents never say this, but they would love it secretly if you could be independent, healthy, and smartly independent people who can think for themselves. They would love it. They may never admit it, because they're afraid they'd lose their kids.
Mhm.
That's
Yeah, and kind of branching off the individuality you talked about in everybody's journey. I think sometimes it's really easy for people to say, oh, this is what low self esteem looks like, and kind of put it in a box. But in reality, low self esteem doesn't look the same for everybody. Why does low self esteem look so different in everybody? And what are some of the main characteristics that influence that?
well, as I said earlier, low self-esteem can come at you as low self-esteem. Somebody who's feeling low, in terms of mood, behavior, interest level, energy level. It's depression. In short, it could look like depression. Other people, it looks like they're perfectly happy, maybe too happy. Those are two examples, two extremes. Low self esteem, remember, it comes from feeling loved, one. It comes from feeling like you can love yourself too. Of the two, I would say being able to love yourself is more important. If you can do that, and the magic of how you get there is my whole profession is about that. You know, it would take me 20 years to tell you all the things that help us become, cognizant of our goodness and of our lovability. Once that happens, low self esteem as a problem goes away and it's replaced by life problems, things you want to do, things that you want to accomplish. I mean, it doesn't take away life, it just takes away the danger, the burden of not feeling adequate to the job, not feeling competent, not feeling like you have the creativity or you have the resilience to come back. So this is all about a fight for resilience from the inside as well as from the outside. So most people will talk about what do you do on the outside? How does it manifest on the outside in different ways and why? Look, if the person who says, I don't feel low self-esteem, I feel great esteem. I feel like I'm, the Queen of England or the King of Prussia or something. What they're doing there, they feel like they cannot honestly admit to themselves or to anyone else about how fragile they're feeling. So they're harder to reach. They present as people who are, extremely qualified for everything. They feel like they can do anything in the world. That's how they would present because they can't stand the vulnerability. The other side, they feel like they can't even begin to say they feel great. So they connect by saying, I am getting crushed, you know, in small and large ways. And I feel like I'm losing myself and I need help that way. They're both talking about self esteem.
Yeah. And to kind of cap off with our last question, one of the big things that shape people in life are friends, our family, are the environment, maybe financial, maybe not, in the way they grow up. How important would you say friends, family, and environment is in self esteem?
I think it's extremely important. I think it's like oxygen to a human being. It's that important. I would say, though, that maybe more important than that, if you can imagine anything more important than that, it would be the person's ability to seek the goodness of a society or family out. Because there are people who are not able to reach out enough. They can look at, love around them every second, but not be able to see it. Those are the people we need to really worry about. They're the people who say, even if, it's like having tons of money around them, they say, I'm poor. I feel poor. Those are the people who have the worst problems mental health wise. Otherwise, is if, somebody once said to me that the person who discovered the North Pole when he was there in this driving snow, sets up a tent, gets in this igloo-like place, and starts to live there for like weeks and months on end. Within the first 2 weeks, he says, I think I'm going to stop using my fork and knife because I don't, and nobody's looking at me. I don't need these. I'm going to eat with my hands, my fingers. And then day by day, he loses everything that we would call societal things, the customs, the traditions. By the end of the first 3 months, he feels like he's going mad. And this man, he was anything but a madman. He was a completely alive, fully integrated, high functioning man, who was left in the 19th century on a ship, went to the North Pole, saved himself, saved some of his men, discovered the North. So if he could come down that fast without a societal safeguard around him, you can imagine what would happen to us, the rest of us. So I would say, in short, that it's extremely important for all the things you mentioned: family, school, people, friends, which I emphasized earlier. And I would say the ability to connect when you need to, and not be shy about it, not be ashamed of it, not feel like that's a problem. That's not a problem. That's just being human.
Thank you so much for your time and your insight. It's a great, great topic to talk about, and it's something that does need to be talked about more. I feel like high schoolers, especially high schoolers in this area, are sometimes burdened because they have their whole life ahead of them and they don't know what to do. And sometimes they lack that emotional support. So once again, thank you so much for your insight and your time.
Thank you. Good to be here. If there's another opportunity to talk, I'd love to do that. Thank you.
Thank you.
Bye.